Should you stop icing? Are you delaying healing by doing this? All started in 1978. So Gabe Mitkin coined the phrase RICE for treatment after an injury.
Right.
You have rest, ice, compression, and elevation for soft tissue injuries.
Right. So ankle sprain, you do those four things, and it's the way you start out your treatment.
This is where things get a little interesting. 2000 teens, he announced rest and ice can actually delay healing. And so the guy that came up with the phrase that can delay healing and actually cause additional damage. So as far as studies, I did see one recently about moving, like, about rest versus moving after injury. And they had found that, yes, low intensity movement was a lot better than rest after an injury. Now, we're not talking about a fracture, of course.
Sure.
We're talking about, a strain but getting the muscles moving. I can buy into that.
The movement's going to be pretty subtle at first, I would imagine.
Right.
Even just get the muscles to contract so we get some fluid movement in the tissue.
When I asked if you should ice something, he said, no, it's the worst thing you can do. You're trapping waste in and around the damaged site.
Okay.
I do buy into that. You're preventing the flow of oxygen. So, anything that supplied via that blood circulation is not being supplied because ice does slow it down.
Well, vasoconstricts is what the theory is.
Well, yeah,
pushes out fluid.
Then it might bring it back in.
Bring it back in when that was the theory. So now we've got a different theory.
Yeah. And he said, too, it can cause additional damage to tissues and nerves. Chris and I had this discussion when we were talking about ibuprofen.
Yeah.
And I said, does that delay healing because it's delaying the swelling?
Oh, right.
And he said, yeah, it could.
Yeah.
So it's interesting,
Right. The inflammatory phase of an injury is good.
Right.
It's part of what the body is supposed to do to heal.
Again, what they recommend is active recovery or using a muscle stimulator. On the areas to make the muscles work on their own.
So like a TENS unit that has EMS.
EMS unit.
Yeah.
Has electrical muscle stimulation.
Right. So I would think water, if you had a pool or something where it may be more comfortable to move the ankle or the knee, but that's not very accessible for certain people.
Right. Yeah. Well, are you talking about an ice bath?
No. Just
water.
Like a pool.
Oh, sure.
So,
ice does help with pain and swelling. There's no doubt. But, they're saying the body knows how to heal. There was, ice was never around for the early ancestors.
Well, in the wintertime it was. Snowbank.
There we go. But so, again, we're not arguing one way or the other. We're just presenting it to you. You can decide. And, I'm sure there'll be more studies that come out.